Good evening. How's everybody doing? It's Dr. Mia and Joseph, and we're here on Ageless Intimacy. And today we're talking about hormone balance and weight management with Ageless Intimacy with Dr. Mia and Joseph. Hey, Dr. Mia, what's going on?
What's up? What's up, y'all? We'll introduce ourselves. I'm Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer weight management, hormone pellet therapy, intimacy services, laser hair removal, and total wellness services. Did I say hormone balance?
Yep.
We also offer gynecology to women and adolescents, and I have a team of 3 providers, including me, who want to teach you to live well, age well, and experience everlasting intimacy. You gonna introduce yourself,
I
Joseph?
did. I'm Joseph. I do whatever she tells me to do.
All right, so today we want to talk about hormone balance and weight management and how they all go together, because we all know that as we age and mature, our hormones change and our bodies change completely. And a big component of that hormonal change, one of the largest complaints that I have from women and men, is belly fat and weight gain, as well as muscle loss. So we do know that with the change in hormones, it can definitely negatively affect your weight. And we do know that with hormone balance, it makes it much easier to lose weight as well as keep it off. So, Joseph, from the male perspective, you've been doing hormone pellets for probably the last 6 to 7 years.
Yeah, probably about 7 years.
7 years.
Yeah.
And what did you notice before you actually started doing the pellet therapy with your weight, and then compared to what you noticed after you've been on the pellet therapy for a while and your weight management?
Well, the one thing I can't say is I can't really remember too much before because I have been on them so long. So it's become a way of life. But what I do know is as I get older, my weight is harder to manage, and it does make it a little bit more manageable only because I have more energy, not because I'm doing, having great workouts and stuff like that. Because I was working out probably more 7 years ago than I am now, but it's more manageable now because I have good energy and I can work out and I can, do a little bit more than I probably would do in a day. And I'm not sleepy in the middle of the day. So I'm not feeling, lack of a word, lazy, but I'm not feeling
Exhausted and
exhausted
fatigued.
and
Yeah.
fatigue. Yeah, fatigue is the word I'm looking for. So I'm not feeling fatigue. So when I get home, if I want to work out at night, I can still work out. I work out during the day, but if I need to work out at 8 o'clock at night, I still could put in a good workout at 8 o'clock at night if I needed to. So I think the biggest change is that energy I have to actually get a workout in.
Mm-hmm.
I think that's the biggest change.
And then when you work out, do you notice a difference now that you're doing the pellets compared to before the pellets? Do you notice a difference in your muscle mass or belly fat or anything?
Well, one of the reasons, well, it was the two main reasons for doing the pellets was, number one was my fatigue. You remember I had extreme fatigue in the middle of the day. The second was I'm a pretty muscular guy, and I was losing muscle mass. If that makes sense to anybody who works out. I have a pretty broad shoulders and pretty big chest. I'm 50 across. So, and no matter what size I am, but if in a suit, I wear a 48 and I could be 225 and wear a 48. That being said, when you start losing muscle mass, you can tell, you can tell as a man, man, my chest is getting smaller and it shouldn't be, and even I was working out at that time though.
Mm-hmm.
Like we were doing at least 4 days a week,
Mm-hmm.
so about 45-minute workouts. So I shouldn't have been losing any muscle mass because I wasn't working out to lose muscle mass. So that being said, that was the biggest thing for me was, man, I'm losing muscle mass. And I could tell because I've been a pretty muscular guy my entire life.
Mm-hmm.
So I could tell that. So the fatigue and the loss of muscle mass were the two things that was kind of alarming, I guess you could say, to me and my
Like Marley must have had this shirt because this whole thing just stretched out. But anyway, yeah. So I've also noticed too a difference. So remember on my weight loss journey, I had a daughter and I gained 60 pounds. And then that's kind of what got me into this whole weight management thing because I couldn't lose the weight. I ended up going to training through the Center for Medical Weight Loss, opened my weight management clinic and gynecology practice in the Bella Wellness Center. And so as I was teaching my patients to lose the weight, I was doing all the things and I was able to lose the weight. Well, when I lost the weight that time, my weight was much lower than this time, even though everything looks different. But then I was not doing hormone therapy and I was not working out a lot either. So I lost a lot of weight, but I probably lost a lot of muscle too. And my metabolism then was like 1400. So go forward a few years, I started back gaining weight. Then
real quick, what should your metabolism?
It depends on the person. So I'll compare that to what it is now after working out of testosterone. Okay. So it was like 1480 then. So, I was keeping my weight off and everything. And then I hit around that 37, 38 mark and my weight started to come back on. And I was still doing all the things I had been doing with the exercise, the eating healthy. And that's when I went to training for my hormone pellet therapy and I got my first pellet. So I think the biggest difference for me with hormone balance and weight management without it is that once I got the hormone balance at 38, I started noticing that I was getting more muscle. And when I exercised, I was losing more of my belly fat and I was noticing more muscle definition. But more important than that, after rechecking my resting metabolic rate test, my metabolism went up significantly. So now it's like 1900 compared to like 1400 then before testosterone. So what I remind everybody that testosterone does, besides helping with sleep and sexual function and night sweats and energy and focus and memory and mood and joint pain and belly fat, is that it does help with weight management indirectly. So testosterone helps you to hold on to muscle mass again, which helps to increase your metabolism, which keeps you from getting as much belly fat and which helps you to maintain your weight and lose your weight better. But the other part of it is the emotional stability that I now have with the testosterone because I don't have as much anxiety or irritability. So I don't emotionally eat as much. So I think that even though it's indirect, like, I can just get on a hormone pellet and you're going to lose weight. Right. You can get on the hormone pellet so that you can do the things that you need to do in order to lose the weight and keep it off.
Absolutely. Yeah.
So that was my biggest difference is the muscle mass, the metabolism, and then the energy to exercise and exercise harder, and then not focusing on food because of anxiety and irritability.
Yeah. So we're talking about hormone balance and weight management tonight. And one thing I want people to totally understand is they do work with each other, but you still have to do the work.
Right.
Like you cannot not work out and get on testosterone and think, oh, I'm about to drop 20 pounds. It's not happening. You still have to do the work. And even with the weight management, and you notice we don't say weight loss, we say weight management because we want you to lose the weight and keep it off and manage it at the same time. Even with weight management, there are certain things you have to do, and it's not necessarily has everything to do with workout, but it also has everything to do with how much water you drink. It also has everything to do with what you eat, what you put in your body. And I'm gonna be honest with you. And when you eat, and I'm gonna tell you this, and Doc may disagree. You can eat cheeseburgers, but you can't eat every cheeseburger.
Right, and you can't eat cheeseburgers all the time.
You can't, and you can most definitely not eat fast food restaurant food and think you're about to lose weight and have a healthy life. No, there are skinny people who eat fast food. They're dealing with major chronic issues right now. So do not think that is something good for you to eat. You can have cheeseburgers, but you want to have a good cheeseburger that you probably should make at home. All right.
And you probably don't want to eat the size of the cheeseburgers that they serve in the restaurants. You probably want to limit that portion and eat a smaller amount.
Right. So good meat, good food, good vegetables, like you say, instead of eating canned vegetables, fresh vegetables, things like that. So back to hormone balance, Doc. What are some of the key things, and I'll go over some of the key things I know on our side, but what are some of the key things that you're seeing in 2024 for our new people, not our old patients, but our new people are starting new with hormone
Hormone.
balance, what are some of the key issues and complaints that you're hearing?
Well, I think one of the main things is people don't know the right lifestyle to live so that they can lose the weight and keep it off, because nobody's ever really taught us how to lose the weight. But I would say one of the biggest things is that my patients who start the pellets now, they tend to start losing the weight because they feel so much better and they have so much more energy, and they can actually focus on it and make healthy choices.
Mm-hmm.
They have the energy to get up and exercise or exercise after work. They make sure that they have their breakfast in the first hour, and they're eating every 2 to 3 hours.
But what are some of the key issues that they come with?
Is that they don't know how to have a healthy lifestyle. So they losing muscle, they gaining belly fat, they not eating breakfast, they eating 1 or 2 meals a day. They're really anxious and irritable. They tend to snack in the afternoons and the evenings because they get more anxious and irritable. They don't have the energy to work out, and they don't have the energy to make good choices for food, because a lot of times their mood is so off that they're using food to treat their mood. Mm-hmm. So those are, I mean, most of the people that come in, they just gained a bunch of weight. Either they're perimenopausal or they just transition into menopause. And even if you were doing testosterone therapy and you transition into menopause, a lot of women will notice a weight gain when their estrogen levels drop and decline. So the hormone balance just makes a big difference overall with metabolism. But I think that the biggest issue with most of my patients is they don't know how to lose weight in their new body, because as you go from premenopause to peri and postmenopause, your body changes so tremendously. And so it's hard to figure out what's going to work for you.
Mm-hmm. Mm-hmm. So you talk about premenopause, postmenopause, and habits that people are.
Oh, and not sleeping.
Oh yeah, not sleeping.
You can't lose weight if you're not sleeping. So most of my patients that first come in and they're not on hormones, they don't sleep at night, or it's hard for them to fall asleep, or they're waking up throughout the night and they're never getting that good night's sleep. And if you don't get good sleep, your body stays in a stress state. So your cortisol levels are going to be high, and it's really hard to lose weight without sleep. So with the hormone balance, they start sleeping again. And so they also notice that their weight management improves significantly with the balance.
And if you're not sleeping, then you have focus issues.
Yep. And you're anxious, and you're irritable, and everybody getting on your nerves, and you're tired.
Mm-hmm. So, all right. Well, good. So you just talked about you can't lose weight if you're not, you can't manage your weight if you're not sleeping, so we get the hormone replacement therapy. Now we're sleeping. Now we're starting to get more energy, but we're still eating. And even though we feel great, we're eating great too, but not the right way. So how does that help with our weight management now?
So I think that now you can make healthier choices. And you can put yourself more on a schedule because you have more energy. So you can actually wake up and exercise. You can wake up and make sure you have that breakfast in the first hour.
You don't have any brain fog.
Yeah, you don't have a brain fog. So you can actually plan your day, do some meal prepping at the beginning of the week. Go to the grocery store and plan things out. And then drinking the water, but also being on a schedule with your eating, because as we age and mature and our metabolism declines, it's necessary to eat frequent small meals to rebuild that metabolism, and to eat breakfast within the first hour. I know a lot of people like to do intermittent fasting. That's fine for the people that it works for and that they feel like they can do that for the rest of their lives. But what I've noticed is that if you start off eating breakfast and eating a healthy breakfast with protein, fiber, and or healthy fat, and you're eating every 2 to 3 hours, then you're eating smaller portions, but you're eating more frequently. So your body metabolizes the food rather than storing it for fat if you are skipping a lot of meals.
Right.
And the energy is better if you're eating frequent small meals. If you're eating 1 or 2 big meals a day, then you're going to be more tired throughout the day too. And you're going to be more irritable and anxious. So you're going to be more likely to emotionally eat. So, keeping that whole emotional eating component in the forefront as well.
Then also your metabolism, you're slowing your metabolism down.
Right. And it's slowing just as we age in general. So that's what we're fighting against. So not only can you help with your metabolism by building muscle and doing the frequent small meals and eating breakfast and drinking your water, and exercising. But again, the hormone balance with the muscle building will naturally help with your metabolism. But it requires you to change the way you're eating and what you're eating, and making sure you're getting your fruits and vegetables in, and you're getting your healthy fat in, and you're minimizing those carbs as well, because that will affect your mood and your emotional eating and your cortisol levels.
Good deal. So again, we're talking about hormone balance and weight management, and how they go together and how they work with each other, but you still have to do the work. Part of the weight management for us is it's a few steps that we do at Mibella when it comes to weight management. One of them is you have a consult with Dr. Mia or one of our providers, and you talk about your where you are currently. And then we give you a plan. Part of that plan is called the rested metabolic rate test, right? And that is a machine where you sit in the room, put this thing in your mouth, and
clip your nose,
and it takes your it will tell you what your calorie intake should be for a day.
Mm-hmm.
All right.
Based off the CO2 that you're breathing out, is going straight in that machine,
right.
And it'll calculate your resting metabolic rate, which will let me figure out how many calories you need to eat to lose weight and to maintain weight. And then we figure out something that's going to work for your lifestyle, because it's going to be different for everybody.
And then the next thing you do is you get on our scale. And on that scale will tell us your
muscle mass,
the
fat percentage, water
percentage,
and your weight and height, and calculate your BMI. And it will calculate like a basal metabolic rate, but since we do the resting metabolic rate test, we go by that because that's definitely more exact. But accurate. The thing I really like about the body composition analysis, because we're always talking about muscle with age and weight management, so it will make sure that you're not losing muscle,
right?
Because what a lot of people are doing with these wonderful, and y'all should attend the webinar on Tuesday. We'll be talking about weight management, menopause, and osteoporosis. So we'll go into a lot more detail about this. But one of the main reasons we do that body composition analysis scale is to make sure that when you're losing weight, you're losing fat and you're maintaining muscle. What a lot of people are doing is they're getting these great new medications that really control appetite, but they're starving themselves. They're not eating enough protein. They're not eating enough calories. And so then they're losing this weight really fast. Well, they're excited about that, but they're losing muscle. So it's going to be easy to regain the weight if you lose muscle, because it slows your metabolism. And so once you get off that medication and your real appetite comes back, you haven't retrained the behavior. You haven't figured out a lifestyle that works for you. You've been totally dependent on the medication. So at Mibella, I think the biggest difference is, instead of us just giving you a shot and letting you go and just give yourself a shot and lose weight the wrong way, is we actually do the behavior modification. We monitor your muscle mass. We monitor your resting metabolic rate, because it's going to change. So we like to repeat that as well. And then we figure out a plan that's going to work for you and your lifestyle. And a lot of people are going to do some similar things. But for example, if you work at night, your plan is going to be totally different from somebody who works during the day. If you don't work at all, it's going to be different from somebody else, because you have, different options for your cooking, and you're making your meals and all of those things. So I think the individualized program, but focusing on you losing the right weight, meaning the fat, maintaining the muscle, and truly developing a lifestyle so you can lose the weight and keep it off, and not be like me in my 20s, 30s, early 40s, where you just kind of trying to figure it out and you all over the place and your weight is going up and down, because that's not healthy either.
Mm-hmm, mm-hmm. So in short, what she said was, don't get out here taking these shots and you trying to get your strippergram body, and you look up and now you 135 pounds, but no shape
and muscle
and no muscle.
Right.
Your shape come from muscle.
Right.
Okay. And you out here and you got your little two-piece on and it look like it's about to fall off of you because you lost all your shape.
Right.
You have to manage that properly.
Right.
And we manage it properly. We have a system and a program that allows you to keep your keep your muscle and lose the fat.
Right.
That's weight management.
Right.
And good muscle is good weight.
Right. Yeah, you want the muscle
Yeah.
mass and you want the metabolism. So yeah, so I mean, I think there are some great new medications out here to make it much easier to lose the weight and keep it off, but don't leave out the true behavior
Right.
modification and lifestyle changes, because you shouldn't have to be on the medication forever.
Mm-hmm.
And I lost my weight last year. I gained weight, and I did the injections for probably about 2 months, and that allowed me the energy to figure out what worked for me while my appetite was under control. But my goal was not to be on anything for the rest of my life to keep my weight off. And so I had to figure out what worked for me. So I know if I eat breakfast in the first hour, I usually do a protein shake. If I'm, putting on my timer, making sure I'm not skipping meals, keep my fruits and my nuts around for my snacks. And I'm paying attention to my calories, doing my resting metabolic rate test regularly, so I know how many calories, and then getting on that body composition analysis scale to know that I'm losing fat and not muscle. It's made it much easier. And I will say, over the holidays, I fell off again. And so what I did recently was I did 2 shots. For 20 days, I did 1 shot, and then 10 days later, I did another one. But because I have a real lifestyle, it was able to get me right back in shape so that I don't have to keep taking any medication every day just to maintain weight. The goal is to use it as a help aid, figure out what works for you, wean off of it, and only use it as needed, which shouldn't be often if you truly develop a healthy lifestyle.
All right. Again, we're talking about hormone balance and weight management. And we just was going over some weight management, I guess I'm not going to say ideas, but philosophies that we have in weight management. We don't say weight loss, because weight loss helps you lose weight, but it doesn't help you keep it off. We help you lose weight and keep it off. That's why we say weight management. So we talk about keeping the body muscle, losing the body fat. Again, don't go ahead and taking these shots. This is an appetite suppressant. You still have to eat healthy foods, healthy proteins, and stuff like that. That's why
healthy fat, yeah. And you need to make sure you're not losing muscle.
Yeah, and you can't go around and be like, I'm just not eating because I'm not hungry. It's not normal,
and it's not healthy.
And you can eat. You just have to eat the right stuff.
Right, yeah. And that's the other part. So you go on the shots, and you're not eating a lot, but you're eating all the wrong things. So also figuring out what foods work best for your body.
Because as soon as that shot wear off, guess what's going to happen?
You're going to gain the weight back.
Eat immediately. And if you don't have a program or a lifestyle, you'll be on the shots forever. And that's not nothing's good forever. So what we're trying to coach you to do is manage your weight.
And create a healthy lifestyle.
I want to be a healthy 230-pound person, right? You know what I'm saying? So for me to manage that weight, I have to eat a certain way and work out a certain amount of time. I can't take shots to do that, though.
You could take shots to help you figure it out, but not to maintain it and do that long term. So the goal is, and I do have some patients who really have some real emotional eating problems. So even once they reach their goal, they may do the shot like once a month. You know what I mean? Just to kind of maintain, or some of them won't do it unless they see that they go up a certain number of pounds. Then they come back in, start back doing the behavior modification, start back weighing in. So we do a maintenance program as well to make sure that once you lose the weight, you actually keep it off.
So that being said, this is not a cookie cutter type of system either. Everything is pretty custom per person. The direction you go is what direction is best for you. So it's not a written down where we can pull up and say, this is the process we go. No, this is the process we have developed for
based on you. And it depends on and everybody that need the once a week shots. For some people, eating is not the problem, it's not eating. So some people may need the injections to help control appetite and to retrain. Some people may need Contrave, which is a medication more for emotional eating and anxiety. Some people may need to start off with phentermine or Adipix because it's really strictly an appetite thing and they need to retrain behavior. So there are many options out there now for help aids. But again, the goal is to use the help aid to reach your goal. And our goal is to figure out the lifestyle for you to lose it and keep it off. So y'all make sure that you sign up for the actual webinar that we're having on Tuesday. I'll be talking about menopause, weight management, and osteoporosis. We're going to talk about the weight management drugs, some of the different options out there. We're going to talk about some things that have worked for some people, and we're going to do some case studies. So go ahead and sign up for that free webinar. It'll be lots of information, and I'm going to be there and available to answer any questions that you have. So we hope to see you on Tuesday at 7 p.m. Central Standard Time, so that you can get all your questions answered and learn how to live well, age well, and experience everlasting intimacy. So we can't end the show without Joseph's tip for the week. So let's end the show with his tip for the week. And thank you for tuning in.
I didn't even think about a tip this week, to be honest with you. I don't know. What's my tip for the week? My tip for the week would be make sure you're drinking your water up to 100 ounces a day or half your body weight, and move your body. Mm-hmm. If you're sitting at a desk most of the day, get up and walk around, move your body, and start some type of workout if you're not working out, whether it is you go in the gym or you do some burpees,
or a dance class,
or a dance class, but a dance class, you got to go to a dance class,
No, you can do them online now.
Or you can start doing about 10 burpees a day. Trust me, you do 10 burpees and you move that up to 20 burpees. You end up doing 20, 25 burpees a day, you're going to be a fit person.
Right. But if you haven't worked out and you don't know how to do burpees, then the next thing is to go ahead and get your personal trainer, or at least get some, training classes so that you cannot hurt yourself and do it correctly.
If you have a dog, take it for a walk. Mm-hmm. Okay. Or walk. Just walk your neighborhood. You don't have to walk much. We're hilly, Alabama. We're in Alabama. I don't know where you guys are watching from, but we're in Alabama. It's pretty hilly. Trust me, you take in about 3 or 4 blocks out of your neighborhood, you're probably going to get a good walk. 3 or 4 blocks one way, and that's 3 or 4 blocks the other way,
And my final words would be that health is a huge asset, and it is important to invest in your health because it is your biggest asset. The healthier you are, the more that you can do, the more you can do for the people you love. So start putting yourself first. Make your health a priority and recognize that it's a huge asset and health is wealth. So focus in on it and invest the time, energy, and money into your health because it's very important. So y'all go live well, age well, and experience everlasting intimacy. We will see y'all in a couple of weeks and we'll be talking about something new. I hope y'all have a great week. Bye.
Bye.